Right, so you can't start a 70 years of history of Tenovus presentation without, of course, this picture, the famous original 10 men, of course. You probably all know the story, but I'll just do it very quickly. Their friend Eddie Price had an accident where he dropped a lathe on himself and was very bored in hospital and needed a lot of help and support. So the other 10 got together and raised enough money for him to have a radio and eventually some headphones. And from that then, they thought, well, this is a good thing to do. We're all quite successful. We should now dedicate ourselves to philanthropy. And from that, the 10 of us were born. When they first started out, we weren't a cancer charity. We started off generally with community projects. There was certainly some health projects there, but it ranged from things like a convalescence home for veterans of the Burmese War, a home for blind babies. One of my personal favorites was, I think, just shows the community spirit that really those 10 people displayed, was a washing machine for a lady who'd lost an arm and therefore couldn't do the housework. So just, but looking back at the notes of the sorts of things we funded, the one thing that really carries through all of our funding from 1943 to today, I hope you'll see, is innovation and community. So in terms of cancer, fast forward to the 1960s, prior to us being involved, cancer research in Wales was basically one room at the Cardiff Royal Infirmary. And at this time, actually, if you look back, the reason why Tenovus got into cancer research and funding cancer support projects was that following the war, mortality from cancer had reached 10,000 people across the UK. And that was seen as being a huge problem at the time. Fast forward to today, of course, mortality in about 2010 was about 150,000 a year. So it just shows the scale of the problem and how it's escalated over the decades. So the photo there is, bless you. So the photo there is actually I meant to bring the shovel with me. I actually have the shovel next to my desk. But this is actually a very important moment for Tenovus. This was the turning of the turf and building what became the Tenovus Institute for Cancer Research. Now, the Tenovus Institute for Cancer Research did some really remarkable things for many, many years. And then latterly, also the Tenovus Centre for Cancer Research, where I did my PhD, actually. But probably, as Leanne said, one of the things that we're most famous for was the involvement with the development of tamoxifen, and actually showing that tamoxifen, which was originally a compound designed as a contraceptive, which actually made mice slightly more fertile, wasn't just a bad contraceptive pill, but actually became probably one of the most successful cancer drugs of all time. My favorite fact from my PhD, if I can remember it, was if you add up all the years that all the women took tamoxifen, it would add up to 30 million patient years, and it saved a huge number of lives. But also, of course, we were one of the first 3 founder members of the British Prostate Group. We did some really early research on Zoladex, which as well became a very successful international drug. And it wasn't just in Cardiff. So also, we had a large centre in Southampton, starting off with Professor George Stevenson. And George was actually on the scientific advisory committee when I first started. He was a really nice chap. And he did some of the first early research on how antibodies could be used as therapies for cancer, which, of course, in many ways laid the path for some of the modern therapies that we read about in the paper all the time now, such as Herceptin and some of the new generation of bowel cancer drugs. And actually, for that work in 1983, George won the Hammer Foundation Cancer Award for the most important discovery in cancer research that year. But it wasn't just George. More latterly, also Professor Martin Glennie, who did some really great work on lymphoma and leukemias, and some of the compounds that he designed through Tenovus funding are actually now in clinical trials. And also Frida Stevenson, who was George's wife, who actually did some of the early work on the cancer vaccine, which is still out there and is still around, and that could be a real holy grail for cancer treatment and prevention. But of course, whilst we've funded cancer research since the 60s, the cancer has changed for lots of people. As I said, the incidence of cancer is vastly greater than it has in the past. But also, mercifully, because of research, improvements in treatment, and surgery and screening, also survival rates are are just better than they've ever been. But in terms of just Wales, if you consider every single day, so today, there will be 50 people diagnosed with cancer, or about 52 people diagnosed with cancer each day in Wales. I forgot to update my slide, sorry. And actually, if you consider that Wales actually has the oldest population of all the UK nations, and sadly, old age is a large risk factor for cancer, we actually have one of the highest cancer incidences as well in the UK and actually in Europe. And if you look with our nearest neighbours, it's actually about 20% higher than in England. And some of that is also due to the fact that we have a lot of social deprivation as well, and some of our lifestyle factors are pretty poor in Wales. Whilst more and more people surviving, that throws up new issues, new problems for us that organisations such as Tenovus have to address and find solutions for. Not least that the people who are living with cancer now rather than dying from it also need support and help whilst we do find that cure. So today there'll be about 120,000 people living in Wales who have experienced diagnosis of cancer. By 2030, that's going to be nearly double that. And that's a huge number of people to care for, support, and treat if you consider that we already live in a time where the health service is creaking somewhat under pressure. So Tenovus, in the spirit of innovation and the spirit of really meeting the needs of real people on the ground, we've done a lot of work in looking at what are our main aims and how we're going to actually care for all these people and how we're going to drive that forward. And as Claudia said, the research, whilst today we're focused on research, we're certainly showcasing our services as well. Everything we do is evidence-based. We're the custodians of our supporters' money, but also we need to ensure that we're providing the very best support and care we can to the patients that we see every single day. So in terms of research, and what I hope that today will show everyone, because today what we try to do is cram as much as we can in and really showcase all the different facets of everything we do. We do fund just about £700,000 worth of research every year in Wales. We fund currently 22 PhD studentships in Wales. But also we have a number of health and wellbeing projects as well. We work very closely with our cancer support team, and we also use our research to develop the very best services. So as I said, PhD studentships is something that Tenovus is incredibly proud of. There's a leaflet somewhere when I first started that said, in our history, Tenovus has funded over 200 PhD studentships. I wish I had that list somewhere. Some of them might be rich now. But if you consider just some of the people that I know, and now working in some of the top labs all around the world, and certainly what we've really tried to do with our PhD studentship program now is make it something really special again, something that people are proud of and want to be part of throughout their careers. And part of that actually is the exhibition downstairs. So I really would encourage you, during the breaks and lunch, please go up and see our students and their exhibits. We've actually given them 2 days training in TechnoQuest. So we really feel strongly, just generally, in everything we do with research, to make it as engaging, as interesting, as fun and memorable as possible. But also, we're acutely aware, as I said, that ultimately we're serving patients and clients, and we're using the public's money. So what we feel very strongly about is involving patients and the public in the decisions about what and how we fund. So we did a bit of work a couple of years ago where we actually used our charity shop chain as an opportunity to survey the public. We make, a lot of our income comes through our charity shops, and it seemed only right that we asked the people that brought in their bags of donated goods or bought the products that, what their attitude to it. So it was a range of things, but certainly prevention, support, lots of the activities we're already engaged in came very highly. And actually, what that process started was a really thorough patient-public involvement pathway. So basically, how can we involve patients and the public in everything we do? And I see some members of our research advisory group over there, and Stephen Thomas this afternoon will be telling you some more about that. So don't worry too much about the slide, death by PowerPoint. But it's basically, what I'm just trying to get across is that for every pound we get in, there's an extremely thorough process to ensure that we don't just fund the very best, the most excellent research that we can, we also fund the research that is the most relevant to real people affected by cancer today. And I just want to show something from just the last 5 years. As we've diversified and as we've tried to meet the needs of people and diversify our research to be more complementary as well to the services we provide. We've actually gone from funding three excellent research projects, but today, with our PhD studentships, the 2 master students that are just starting in October, our Singulus project and our innovation grants, we now have, as of today, about 37 research projects going on all over Wales. And as you can see, that was 2008. And today, we can really truly say that we have a geographical spread across the whole country. Who doesn't love that? So yeah, and you know, we have projects now everywhere, and what's a really nice thing we can do now is, you know, for communities in West Wales, North Wales, South East Wales, we can say there is a student, there's a project down the road from you. Come to the lab, come to their office. Just talk about research, be involved. Again, don't worry too much about that. But what I'm trying to illustrate is the other thing that's really exciting about working with Tenovus is that because we see patients every day, there's an amazing opportunity to actually identify their needs, turn them into research projects that ultimately develop services. And some great examples of that you'll be able to see today. Probably most notably, of course, the Sing With Us project, which started life as a small research project, and more on that this afternoon. But also our creative writing groups as well started life as a research project. Our health check, walking groups, and hopefully you'll be able to get a flavour for all those things. So I'm just going to end on this. Let me just read it from here. I found this, and I just thought, for some reason, it struck a chord with me. In the evening, I met the toughest audience I ever met. You guys are great, though. This is basically Bryn Calvin Thomas, and he was the organising secretary of Tenovus, and he went on a trip to the States to meet a Nobel Prize winner and visit his lab. I felt like a very cheeky Welshman come to show a big, rich granny how to suck eggs. So I concentrated on why Tenovus had succeeded, by never forgetting that behind the intricacies of the organisation, behind all the consideration of collecting and distributing large amounts of finance, behind all the complicated, almost incomprehensible research programs, there are deep human problems of pain, anguish, of sorrow, and separation that too often all the finances of the world seem too futile to combat, and all the brains of eminent investigators seem inadequate to solve. And I think what we're trying to say there is, you know, that's how we feel now. You know, there's behind everything we do, ultimately there's a patient. Thank you very much.
I want to know about your mobile ice cream van.
Yeah.
Tell me about that. This is the man who set up a laboratory in an ice cream van. Is that not right?
It is. It's a TechniQuest on Sunday. Feel free. So the ice cream van,
Have you always wanted an ice cream van?
I'd always wanted an ice cream van. But there's a serious side to it, actually. What it was, we were going to do a sun awareness campaign. And at Tenovus, we don't believe necessarily in carpet bombing the world in leaflets, because people don't generally read them. You've got to really take stuff to people, engage them, like the mobile unit, classic example. So I sort of said one day, why don't we get an ice cream van to do this sun awareness campaign? So we rented one first of all to just show that it worked, so we didn't have an ice cream van gathering dust. And it was great. We went on a little tour. It's fab. So we used it for
have real chimes and everything?
We had to take the chimes out, sadly, and the ice cream maker, and the Bay Marie. But it does have a plasma screen in it, and it has quite a good sound system.
Well, that's all right then.
But what we've also done with Karen Reid, who's in biosciences, taking the ice cream van to events, and we can take a swab of someone's mouth and plate it out onto a cover slip, and actually print out a picture of their own cells, and then say, this is one of your cells. And if you smoke, drink, you sunbeds, then you damage the cell, and that can give you things like cancer.
Very good. Fantastic.
So yes, Sunday TechniQuest. I'll be there.
Thank you very much, Ian.